Cases of congestive heart failure increase as we head into the holiday season, not just from the stress, but because of what we eat. Today on our show, we're going to learn a little bit about the different types of congestive heart failure, both acute and chronic, as well as compensated and decompensated. We'll learn how to prevent flare-ups as well, and we have a great team of professionals to talk to today, including Dr. Kevin Whitney, Ann Miker, Sharon Warden, and Megan Volz. From the Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Hey folks, welcome back to Wisconsin Doctors. We're here at Bluff Medical Center, and we're going to learn a little bit today about congestive heart failure. And I'm joined by our team of experts here today. This is Ann Miker, Dr. Kevin Whitney, Sharon Warden, and Megan Volz. Welcome to the program.
Thank you.
Thank you.
Good to have you with us today. So I guess the first thing, the thing that makes most sense to start out with is what exactly is congestive heart failure? We've heard of it, but what exactly is it?
So we have to think of the heart as our pump for our body. It moves blood to the many important organs of our body, and so for our body to be happy, it has to do that very effectively and efficiently. So congestive heart failure is a case where that pump is not working for whatever reason efficient enough that blood is starting to back up maybe into our lungs and making it hard for us to breathe, or fluid is starting to back up into our legs, lower extremities that can cause swelling. So we sort of see that as sort of a pump that's failing for many reasons, there are many reasons, and just not doing its job. So that's the simplest definition of congestive heart failure.
That's interesting because, you know, a lot of times when we hear heart failure, some people might kind of think heart attack, something severe and sudden. Right. That's not always the case.
No.
So, and there's different, there's acute and acute and chronic congestive heart failure. What's the difference between acute and chronic?
So chronic congestive heart failure is somebody who's had a problem for, say, a long time. Something came up that their heart and pump is just, it's able to keep them so they can function to some degree every day, and they've learned to live with that. Acute comes to the point where all of a sudden something they had chronically becomes hard for them to live with. They have more shortness of breath, they see more lower extremity swelling. It becomes difficult for them to do the things that they were able to do when they were, say, in chronic congestive heart failure.
Very interesting. And I promise our viewers at the beginning of the show that they're going to learn a lot today, as I am as well, because there's also different types of congestive heart failure, compensated and decompensated congestive heart failure. What's the difference there?
So the ones, since all of us work in the ER, the one that we see most often is the decompensated. So it's not, the patient has lost the ability for their body to control it enough that they can function. So their heart is failing now that their lungs have filled up with fluid, they're extremely short of breath, they've got lower extremity edema, and they're feeling quite uncomfortable and miserable in their home setting. And so much so, sometimes they're so short of breath just sitting in their chair. So that would be an example of pretty significant decompensated. Compensated means that I have congestive heart failure, but maybe I can go for short walks, or I can walk around my home, I can do my daily cares and care for myself, and function throughout my family setting. But over time, people can slowly move from a compensated to minorly decompensated. So for example, if I'm able to walk 4 blocks and then all of a sudden I can only walk 2, then I'm starting to move into a direction I'm having more trouble to compensate for my congestive heart failure. Okay,
very interesting. And how is this typically diagnosed in the clinical setting, any kind of congestive heart failure?
So our family physicians are very good at Mile Bluff at recognizing this, largely just because they know their patients very well, and the patients come in with a change in their situation. So they start having more shortness of breath that's unexplained. So symptom and history are going to be very critical for the doctor to make the diagnosis. But then they might consider doing something like an echocardiogram, where they would see a cardiologist and they put an ultrasound on their heart and look at their heart function and dynamics. They may put them through some stress tests where they walk on a treadmill to see how their heart functions when it's exerting itself. And they may do some lab tests that help them get a sense of, how well is their kidney or renal function. They may do a test called BNP that helps them see if there's some decompensation going on with their congestive heart failure. But a large part of it, to be honest with you, is knowing your doctor well and your doctor knowing you well and sensing when there's some clinical changes to your condition.
Is congestive heart failure something that needs to be managed in the emergency room, or can that be something where this is a non-emergency, but I'm having a flare-up or whatever? Can I just go and see my doctor?
I think, like he explained the differences between acute, chronic, compensating, decompensating, and it really depends on which type that they're experiencing.
Sure.
So chronically, it definitely, I feel it could be managed by their primary doctor. But if they start having a flare-up where they're getting really short of breath, they're starting to decompensate, as Dr. Whitney was talking about, I think coming into the ER isn't a bad idea, and probably more likely to be managed better in the ER for an acute exacerbation.
Okay, very good, very good. Well, we're going to take a short break here, and we're going to find out exactly what we should do if a patient or someone that you know has an acute exacerbation, and we'll be right back with more Wisconsin Doctors after the break. We are at Bluff Medical Center, and we are discussing congestive heart failure as our topic today. And we've talked about the different types of congestive heart failures, and we also mentioned that the emergency room not always is the best place to manage that. It can be managed within the clinic, but right now in this segment, we're specifically talking about acute congestive heart failure flare-ups or exacerbations. So let's talk a little bit about that. What are some of the most common causes, what are the most common symptoms that a patient with an acute flare-up for their congestive heart failure may experience?
So a lot of times when patients come into the emergency room and they're having a flare-up of congestive heart failure, a lot of things that I see are they're having a difficulty time breathing.
Okay.
They're breathing faster. You can hear their breathing, it sounds labored. They might be, when they can't lay flat, because it makes it harder to breathe. So a lot of times they'll be sitting up, kind of leaning over like this on the bedside. And I always like to listen for lung sounds and check to see if there's crackles there. And you might also see some swelling in their legs, their feet, and that's where there's a lot of fluid that's going there.
Sure.
This is often when respiratory therapy is called down to assist. Dr. Whitney always stresses the ABCs when we're doing an assessment, and airway and breathing are the first steps, and lots of times if we can fix A and B, we can possibly correct C. So that's why respiratory therapy is involved very quickly as well.
Absolutely. And let's talk about some of the common causes that can trigger a patient to go into acute congestive heart failure and might require an emergency room visit.
Something I like to always ask my patients, especially in this situation, is have you been taking your medications? And a very common cause of acute flare-up of congestive heart failure is that they maybe are missing some of their medications that they're taking for this specifically, or maybe they ran out of it and haven't been able to refill it. So that's one thing I like to ask.
Sure. So it sounds to me like fairly often if somebody is having an acute exacerbation, typically they're already aware that they have congestive heart failure. They just maybe didn't take their medicine, or something changed in their routine that caused this flare-up to happen. More than likely.
Yeah, they could they could be having a spike of high blood pressure. Sorry.
No problem.
Their blood pressure could be spiked, and that certainly can lead to an acute exacerbation of congestive heart failure.
Sure.
And we also see that another common cause besides medicine is just not eating the right things in their diet. So their doctors are often recommended a low salt diet. or a low sugar diet. Both salt and sugar can trigger a congestive heart failure flare-up, and the amount of sugar and salt that we as Americans eat is pretty dramatic. When you look at the amounts we should be eating, it's easy to exceed that. Most of us would find a diet that's low in salt to be quite bland tasting and probably not something we're used to, and the same thing goes true with sugar. So that's an easy one to slip up on, and that's often a common cause of their flare-up.
Sugar and salt are, I mean, if you take the time to look at the ingredient labels, it's in so many things. It's hard to avoid it when you go to the grocery store, certainly. What are some things that a patient can do to minimize the frequency or intensity of congestive heart failure flare-ups? Obviously, diet is one of them, and making sure that they're staying on their medication regularly. But what are some other things that they can do to minimize those?
I know from my standpoint, we have a lot of shared patients that also have obstructive sleep apnea and are supposed to be using their CPAP equipment at home. And when they don't do that, it actually puts extra strain and stress on the heart, increases their blood pressure, increases the chance of heart failure as well. So compliance with their CPAP use at home is a major component.
Yeah, so making sure that the airways are unrestricted and so forth. I'm kind of wondering, what are some of the biggest symptoms, the red flags, if you will, that people should be aware of if they know they have congestive heart failure, to look for if they think they might be having a flare-up versus, is this indigestion or is this a flare-up? What should people be looking for and really be paying attention to?
I think Megan hit the nail on the head when she said how she described that. So if a family member sees somebody becoming extremely short of breath, not able to lay back, that's amazingly when you lay flat, fluid tends to accumulate in your lungs and it's harder to breathe. So a lot of times patients are leaning forward and sitting more, seem to just be more uncomfortable. So if a family member notices that dad or mom are always sort of short of breath, but they're more short of breath now. They're working a lot harder. Their chest is rising. And they look like they're getting exhausted or worn out. Those are starting to get to be late signs. You can actually go into a point where you stop breathing and go into failure completely, and your respiratory failure, which would be a very dramatic situation. So I think when you start seeing a dramatic change in the respiratory patterns, that would be the first thing that would clue someone to come in.
Absolutely. We're going to take a short break. When we come back, we're going to be joined by a new panel member here, and we're going to find out exactly what might happen or what you could expect if you do, or someone you know ends up in the emergency room with a flare-up for congestive heart failure. We'll be right back with more Wisconsin Doctors after the break. Hey folks, welcome back to Wisconsin Doctors. We're here at Bluff Medical Center, and we've been learning today about the different types of congestive heart failure. And right now we're talking about what exactly happens if you find yourself in the emergency room with a flare-up. So we have a new panel member here today, I guess, here on the stretcher. So let's talk a little bit about if a patient is suffering a flare-up of acute congestive heart failure, Megan, what can they expect when they arrive to the emergency room here at Bluff?
Sure. So we will take them back to a room immediately. Want to make sure we grab a listen to their heart and lung sounds.
Okay. Yep. Always good to take those precautions, I suppose.
Yep. Check for any crackles,
Sure.
fluid that you might hear. Quickly grab a set of vital signs. So blood pressure, we'd grab over here. Make sure we check their oxygen levels.
Right.
Go ahead, put an IV site in. And make sure we call respiratory therapy and notify the doctor right away.
Sure. And then, Anne, you are our respiratory therapist here for today. So what happens when you come in? And obviously we're talking a little bit about BiPAP and CPAP here. What exactly is that, and how does that help a patient who is suffering a flare-up of acute congestive heart failure?
Well, often when these patients come in, they are struggling to breathe. And our job as respiratory therapy is to assist their ventilation.
Sure.
Often their oxygen levels are low as well. So we have been using BiPAP on these patients and seeing great success.
Okay.
What this does is, because they're struggling to breathe, we are actually giving them breaths through this mask. And it actually increases the pressure in their lungs to open up those oxygen sacs or air sacs in their lungs and to improve oxygenation. And at times patients may not tolerate this initially. It's a mask that we're putting on their face, but once they see how we're actually assisting their breathing,
Sure.
it helps them to relax and calm down and
Sure.
help us with their breathing.
I'm sure relaxation is kind of a part of the whole, like if you have a flare-up, that's an important thing, is that you just
Absolutely.
kind of relax and take it easy.
And a lot of it is education to the
Right.
patient. If they understand why you're doing it, it's a little bit easier to allow us to do this. So BiPAP actually is bi-level positive airway pressure. So
Okay.
we are setting two different pressures, one when they're taking a breath in and another when they're exhaling. So those two pressures are what's allowing those airways to remain open in their chest.
So the BI is bilateral.
By
What is the-
level.
Bi-level, excuse me.
Bi-level, yep,
And then
setting
wh-
two different pressures.
And then what does C stand for CPAP?
Continuous.
Continuous,
So
okay.
continuous positive airway pressure is where you just have one set pressure the whole time when they're breathing in and exhaling. Sometimes
Okay.
that's not tolerated as well as bi-level.
Okay.
And you might see CPAP more with patients that have obstructive sleep apnea, so
Sure.
patients might hear that more for their home use.
Sure, absolutely. So now the other thing that you guys do is you'll start a nitrogen drip. What exactly is a
Sure.
nitrogen drip and how can it help a patient?
So the nitro drip, or nitroglycerin is the
Okay.
full name. We set it up to the IV line, connect it to their IV site, and I always explain to my patients nitroglycerin, a lot of times what it helps with is blood pressures, because they may have higher blood pressures when they come in.
Sure.
They're in a lot of distress. And then it also helps to
Decrease the amount of work that their heart has to do. So decrease
Absolutely.
the pressure they have to work against.
And then let's talk about some of the tests that that happen once they get in here, because obviously we want to make sure that we know what the problem is. So what are some of the tests that they might have?
Besides some of the normal labs that we're going to draw, we have a really neat piece of equipment, our ultrasound device, that allows us to look directly at their lung.
Okay.
And so by placing this on their chest, I can get an image quickly of what's going on in their lung and to see how much fluid is in each lung field. So I'll take an image shot of the left lung and then I'll do the same of their right lung. And then quickly I can take, with a different probe, I'll look at their heart and can get some images of their heart. It tells me the function of their heart to see if they have some pre-existing congestive heart failure, or a little bit more detail allows me to actually listen and see their heart to each of their valves. So right now I'm listening to this patient's mitral valve and I can see that there's a flow murmur, or there's some poor flow through that valve, which is probably contributing to the risk for congestive heart failure and certainly contributing to the flare-up. Another quick look lets me look at his aortic valve. And this murmur is actually even more dramatic here because the valve is thickened. So those are some things that we're picking up immediately on this patient. And just one more image I'll do is I'll quick look at the patient's liver. Their inferior vena cava shows me if there's congestion within their entire system, not just their lungs and heart. So with just some quick images, I'm able to take a quick look with this probe to tell me how much distress this patient's going to be in and how hard it's going to be for us to get them back on track.
Wow, that's amazing that you can get so much information so quickly just from these few little tests. So that's really cool. We got to take a short break here, but when we come back, we're going to talk about a little bit about when it might be time to admit a patient or if they're safe to go home. We'll be right back with more Wisconsin Doctors after the break. Congestive heart failure has been our topic here at Bluff Medical Center, here for our show, Wisconsin Doctors. We just had a great demonstration of what happens when somebody comes to the emergency room with acute congestive heart failure flare-up. So let's talk a little bit about maybe what happens after some tests have been run and things like that. How does the medical team decide if a patient needs to be admitted, transferred to a larger medical center, or is able to safely return home?
So admission status often depends on how well the patient's responding to the treatments that we've been doing. So is their breathing becoming less difficult for them?
Right, and we also look for how the machine, how they're responding to the machine, things like tidal volumes, how they're moving the air in and out of their lungs with the machine, and just overall how they're responding to the things that we can do at our facility. The nitro drip, is their blood pressure staying stable enough that we can continue that, or even discontinue that when we put them in the hospital. When we decide if they should be transferred elsewhere, the decision is coming, do they need something more to keep their blood pressure up? Because sometimes their blood pressure can start to drop. Do they need more intensive intervention? Sometimes patients need to be intubated, where we put a tube down into their lung and then hook them up to a ventilator. Those patients we would typically transfer to a larger facility, such as Gunderson Lutheran or UW-Madison or Meriter or St. Mary's is kind of our go-to facilities in the area. And just because they also have the added advantage of having a pulmonologist available, a cardiologist, and oftentimes an intensivist. With that said, we've had some great success with patients in our emergency room. We've been able to stabilize and take them out of that decompensated mode and put them in the compensated mode, and actually after several hours in the ER, I've been able to send them home very successfully, and we've had some great success with that over this past year.
Good to know. That's very good to know. And let's talk a little bit about, you guys are kind of doing some very state-of-the-art equipment here for sure. We saw some of that in our last segment, but how has Bluff Medical Center used evidence-based medicine to improve the patient outcomes with regard to these exacerbations or flare-ups?
So obviously our focus is quality of care, and how do we know we're providing good quality care unless we're measuring it or comparing ourselves to other facilities? So the sooner a patient can be diagnosed and treated, the better the outcomes are for these patients. That's why we've taken a little bit more of a uniform approach as to how we're treating these patients, and it's prompted for us to look at our patients and do some chart audits. And so we started this actually back in January and looked at all these patients that were coming into our emergency room with congestive heart failure and treated with BiPAP and the other interventions. And we really focused on, are we providing that effective, quality of care without risking sending them home too soon, obviously, as well. So we're looking at trends of readmissions. We don't want these patients to get readmitted. And thankfully, our outcomes and our results have been pretty good. We've had 120 patients come into our emergency room from January till September with congestive heart failure with these treatments, and only 5 have been readmitted, so the outcomes are pretty well.
That's very good. That's very good. And how do some of those statistics compare with the national statistics?
Sure. Well, Dr. Whitney had found some information that's in some areas close to 25% of patients can be readmitted within that first month of being diagnosed with congestive heart failure. So when looking at 4%, that's a pretty good outcome.
I would say so for sure. Let's talk a little bit about the holiday season. We've got about a minute left here, but I want to make sure we get this in. How does the holiday season contribute to the rate of flare-ups of congestive heart failure?
So during the holiday season, a lot of people are eating more than they typically would. They're eating more foods that have salt in them, more sugar. Eating more food in general can cause your stomach to kind of put more pressure on your heart. And putting more pressure on your heart makes it harder for it to pump effectively.
It's working harder then,
Yep. And also fluid control. You might be drinking more. One thing that patients with congestive heart failure want to monitor is the amount of fluids that they're intaking throughout the day.
Really? Okay. So that's interesting because, we always hear drink more water, but that if you have congestive heart failure, that might be kind of a danger if you drink too much because you won't be able to process it.
Yep, and then you'll be retaining it versus... Yep.
Very good to know. And let's talk a little bit about exercise. Obviously, exercise can help a lot of different ailments in terms of prevention and just, improvement. How does exercise help improve a patient's ability to control their congestive heart failure?
Often after a patient has an exacerbation, their doctor may send them to our cardiac pulmonary rehab, and they will set them through a gated exercise program where they start doing more exercise. May just simply start 10 steps of walking, and the more they keep pushing that and challenging their body starts to become stronger with exercise. Exercise also has the advantage to helping with weight loss, and weight, of course, contributes to some of our problems in dealing with fluid. So there's a lot of advantage, and I would ask them to seek out their doctor's advice on who can exercise and when they should be exercising. But it is an important part, besides diet and medicines, to help get them back on track.
Absolutely. Lots of great information here. I want to thank all of my guests, Ann Miker, Dr. Kevin Whitney, Sharon Warden, who had to go attend to a patient, and Megan Volz. Thank you so much for being here today. And from all of us here at Bluff Medical Center and Wisconsin's 57 Television, we invite you to live longer, live better. We'll see you next time.